In this video, we will talk about different scenarios in private health insurance, especially if you have a family or you are planning to have a family, your own family in the near future. So let's get started. Scenario 1, husband is working, wife is not working. Let's say husband more than 69,300 annual gross income, because this is the limit. So you're eligible to switch to private health insurance. You need to have at least this income, because typically at this income level, statutory health insurance would be more expensive than the private one. So you're eligible to make the switch. Your wife not working at all, so let's say zero income. In that case, you would save in private health insurance, let's say 100 euros per month if you make the switch. Since in private health insurance there is no family insurance free of charge, you have to book either a public health insurance or a private health insurance for your wife. So probably you book a public health insurance because this would be cheaper in that case. So we would have minus 200 to 300 euros. Let's do it like this. 1 second. Let's make it pretty. So we have minus 200 or minus 300, something in between. It depends on how much income the husband in that case actually has. Okay? So here, well, in the end, there is a question, are you willing to invest 100 euros per month so your wife also has proper coverage? In the end, if you plan children now, I'm not quite sure if I would do that actually, switching to private health insurance in that case, because one child costs roughly 80 euros per month in private health insurance. Okay, so now you see minus 200 here, minus 80, minus 80. If your wife is not working and you're planning to have children, I would typically recommend that you stay in statutory health insurance. Okay? Let's say the situation changes. The husband is working, still earning more than 69,300, so still saving 100 euros per month. And the wife is also working, but earning less than 69,300, maybe let's say part-time job. Okay? In that case, the husband could switch to private health insurance. The wife stays in statutory health insurance. If you have children, you book, let's say, 2 children under the private health insurance of the husband, so minus 80 per month. Again, so we have minus 60 in total. But 2 children and the husband are in private health insurance, have access to the best doctors in Germany, faster appointments, significantly better benefits. By investing 60 euros per month while you're receiving a children allowance here anyway for the children. Okay, this makes, in my opinion, total sense. Because now if the wife was working, she's eligible for so-called Elterngeld, so parental allowance, and there is a public health insurance included. So even if she's not working because she's taking care of the children for a certain time, it would be covered. If she is working herself, well, easy, then she has her own health insurance anyway, and all good. So even if, let's say, you had only 1 child and you're planning to have the second one, and your wife is moving to the parental time, the Elternzeit, then still no issues with private health insurance, especially for your children. You have access to the best doctors, which makes total sense. Another example, scenario 3, husband is working, wife is working, and both are earning more than 69,300, so both could make the switch to private health insurance. In that case, well, the husband saves 100 euros by switching. The wife saves 100 euros by switching. Now you have 2 children, minus 80, and then you book one child in the other private health insurance. So you have plus 20 here, you have plus 20 here. So in the end, the whole family is in private health insurance. You have significantly better benefits and you're still saving money here. So especially in these two scenarios, it makes sense to make the switch to private health insurance. It sometimes just depends when you make the switch. Because in scenario 3, for example, if you're both earning than 69,300, depends on how much more, might be the case that you earn more than the limit to receive parental allowance. And in that case, you have to be careful, because if you don't receive the parental allowance, you don't have the health insurance included. So might be useful to wait that the wife is also switching to private health insurance until, let's say, you're done with the family planning, just to be on the safe side. If you say we would like to have 2 children, and after the second child, then it makes sense that, for example, the whole family is switching to private health insurance. So you see, it's a complex topic, really beneficial to make a switch, but it always depends on when is the right time to actually make the decision to switch to private health insurance. In scenario 2, someone could claim, yeah, but I'm losing 60 euros. Well, in my opinion, we have health on the one side and 60 euros on the other side. So health should be valuable enough to invest 60 euros per month. But this is my opinion. In the end, you receive refunds in private health insurance if someone stays healthy. So we have here one tariff, and the children have specific own tariffs in the whole private health insurance. So let's say you stay healthy, you receive a refund of 2.5 monthly contributions, including the employer's contribution for private health insurance. Children will receive 1.25 monthly contributions back, which means if one of these 3 people stays healthy in 1 year, the refund is already bigger than the contribution, which means that even in that case, and in my opinion, it's pretty likely that 1 of 3 is more or less healthy in 1 year. Even in that case, you would save money, while 2 children and the husband would be in private health insurance. So if you would like to have help considering if you should make the switch, and if no, when you should make the switch, feel free to register for a free initial consultation. We will talk about all the advantages and disadvantages, and you can make an informed decision for or against a switch to private health insurance. Maybe talk to you soon. Take care.